Hey y'all, it's Dr. Steve coming to you again from Elevate Sport and Spine here in Denver. I wanted to make another video to follow up kind of on the last one that we talked about where we were controlling our pelvis and forward and back space in order to give ourselves a little bit more ability when we're doing things like forward folds and try to touch our toes. Another thing that happens a lot of the time with my patients is that they come in with some low back pain, and it tends to be more on one side than the other, and they're always like, well, why is this? And if I examine them, invariably I'll find that they have a little bit of a tendency, especially in single leg stance, to hike one hip up on that side where they're usually having pain, and that lets me know that there's some stability problems that are going on in the side body that cause their pelvis to tilt one side versus the other. Often with that side body problem, we end up with some rotation as well, which tends to cause pinching towards the strong side of that low back. So a good exercise to look at to kind of reveal any of your dysfunction as well as fix it is to do a side plank. I've talked about those in the past in other videos, but never really focused on a good reason why we should be doing them, and I think it would be helpful to go through why we should do a side plank, which is kind of what I discussed, is about helping us find out why we have some distortion and how to correct it, and then to teach us how to get it better, which is to strengthen things back up. And I'll show you also a few of the more common mistakes that people make that will make it to where if you do this exercise wrong, that it won't really help you. So we'll just kind of break right into it. A side plank is usually kind of something where we lay on our side here like this, and then pop our hip up here like that. Common things that I see as far as problems go is that people are often rotating down this way, and these are the people that will usually tell me that their shoulder hurts worse when they're doing side planks. So a way to fix that is just to make sure that our chest is opened up as we're doing these. And then another thing that we have that happens is that people will kind of push their butt backwards, and I call it piking, which if you looked at me from the top, I would be kind of V-shaped towards the front. So what we do to fix that is to kind of push our hips through a little bit more. And then last, so we need to kind of focus on kind of pushing up underneath here. Another thing that people will often do is kind of rotate down, and I'll usually see what happens there is that they're going to rotate towards that stronger side, and you can also rotate too far the other way, and that would be if my right side was the strong side, I would be kind of seeking that again, so I would rotate out. So we want to try and make sure that that pelvis is pretty flat. You can usually do that by looking straight down, and also we want to make sure that we're in good alignment front to back, and I usually try to run my arm down my side to make sure that everything is in a good line. So if you're having trouble kind of feeling where that is, two options that you have are to have someone watch you do these, and it's usually best to have them standing kind of over the top of you so they can see whether or not you're kind of closed or open through the shoulders or hips, and as well as if you're doing that piking thing where we're kind of folding, forward and pushing our butt back in order to kind of dig into our quads and stuff like that. The other thing that you can do is to kind of back yourself up against a wall, and what we want to do there, same idea, is kind of get into that straight line there, and put our heels against the wall, butt against the wall, and back against the wall, and that'll let me know, okay, pelvis is straight, shoulders are straight and open, and we really want to focus on lifting from this downside. So give those things a try. If you're having any questions about it, always let me know here at the clinic. I know it's a quick, short video, but if you have questions, always feel free to look out. I usually tell people to do about 3 to 5 maximum effort holds, working their way up to a minute, but the important thing really is to focus on making sure that you're only working towards the side that feels harder. So let's say if the left side is the one that feels harder when you're in good position and you can only do it for 10 seconds, on the right side you can do it for 30 seconds. You're not gonna do sets of 30 and 10, you're gonna do 10 and 10 so that we don't feed that dysfunction that you have and make it harder for that left side to catch up. So give that a shot. Again, if you have questions, always reach out, let me know, and then we'll see you next time. Take care, bye.